Listen to this now. Treatment of cancer. And I know many speakers will be coming here. Naturopathic doctors, bush doctors, and herbalist doctors. I am the homeopathic doctors and I come. But listen to me. Go to the doctor who will examine you thorough. The doctor who will examine you thoroughly. Why? Because many patients came to me at the terminal stage. No blood. But where were you going? No, I was going to naturopathic doctor, the JP over there, and he was only telling me do this and do that. I said, but you are not anemic. When I examine infection here, infection there, I'm not against naturopathic doctor. I send patient to some of them, and some of them send patient to me. I ask, did your doctor send for blood count? No. Did your doctor send you for an x-ray? No. Did the doctor did a simple urine in the office? No. How much did you pay this doctor? 10,000. Go to the hospital. While you go to your other doctor, bush doctor, GP doctor, naturopathic doctor, come to the hospital. Because the hospital, we have the facility. I can do an x-ray. The time you step in the hospital, we do a urine test. You're going to pass through many eyes. The nurse will look at you. One doctor will look at you, another doctor will look at you, and we have specialists on our fingertip. We can call any specialist and discuss your case. You can still take your herbal stuff, you can still take your ginger, you can still take your turmeric, but listen to me, when cancer starts and develop, most of those things cannot help any longer. Lifestyle is to prevent the development of cancer. And do not use one person to generalize. If you did drink bush tea and the cancer disappeared, that may not happen to everybody. Are you listening? So you go to the hospital and go to see your other, and you always have a second opinion doctor. They come to me at terminal age, and these are Adventists which should know better. Breast cancer. 3-5 years ago, it did not spread. And the doctor wrote the referral, go to KPH, go to Jubilee, go to UA. And when they show me those referrals, they're outdated. 3 years. By the time they come to us, the cancer has spread all over. We cannot help. So, cancer prevention is possible. But prevention is even easier than to cure the cancer. And we don't wait until we develop. I have diabetes in my family, where I'm so passionate about diabetes because I don't want to get it. I don't want to get it. My brother, one of my brother, I think my sister, they have diabetes. I will not get it by God's grace, but I'm not going to say I will not get it. I eat as a diabetic. I drink as a diabetic. I exercise as a diabetic. I watch my weight as a diabetic. Those days of eating 20 dumplings and syrup, they are gone. I drink water, and if I drink today something, I mark, not until like next week. That's how you change your lifestyle and you change your risk factors. Your risk factors may not be my risk factors of developing something. I have seen patients of third generation prostate cancer. I said, but you didn't check your prostate. If your grandfather had prostate, your father had prostate, what do you think? You still eat meat, you still eat fat, you still don't go to the doctor to check, to put the finger in your rectum for 1 second. What do you expect? You will develop prostate one day. I'm ending my talk. Change your lifestyle. Know your risk factors of the diseases that run in your family. If it's breast cancer, know how to examine your breast yourself. If it's prostate cancer, go to the doctor once every year to check. Do reading. Talk to your doctor. What should I do to decrease the risk of having prostate cancer? If it is a lung cancer and you go and smoke, you are increasing the possibility of developing a lung cancer. The answer to the question, cancer prevention, is it possible? Yes, it is. When you follow a specific lifestyle that will protect you from developing the disease. And if you do your regular checks, earlier diagnosis is always better. You check, you go, you do your routine. Anything that is caught up earlier, it's better, it's easily. But when it is spread, when stage 4, I'm not saying there is no miracle, a miracle can come, but most of the people will not make it because the cancer already spread. If you have it in the lung, went to the liver, get to the brain, right? So that's already a problem. So let us know our risk factors. Ask your mother, ask your father. You know, you have the uncle, you have the aunt. Whatever they have, more likely you can have it if you don't change the lifestyle that will lead to those diseases. I will invite you to subscribe to my YouTube channel on diabetes, as Elaine clearly explained, so that you can see my other teachings in YouTube. In fact, I'm videotaping this one and I'm also going to upload it on my YouTube channel. God bless us as we go through this trying time. Remember, we don't only have COVID. Diabetes is still there. High blood pressure is still there. Right? So don't get only caught up on COVID. Check your medication, take your medication, check your sugar, remember to exercise, to drink your water, because guess what? Diabetes is still killing more than the COVID. My last patient on COVID is 78 years old. You know what helped her? She didn't have sugar, she didn't have diabetes, she didn't have any underlying disease. And I put her on the treatment. I put her on the vitamin C, inhalation, vitamin D, magnesium, brush your teeth, lister your teeth, cover yourself under the fume as the grandpa used to do it, sweat, drink soup. In 2 weeks, she bumps back. When they diagnose you with COVID and tell you go and lock up yourself, call somebody you know, call a brother, call a medical doctor for advice. So that the early the intervention is made, more likely you're going to make it. So God bless you. Keep on fighting. Keep on trusting on divine providence. That whatever is going through now, God helping hand will still be on you. Thank you, Michelle, for the invitation, and I hope that the rest of the program will be a blessing, and God bless you. Bye-bye.